Ben Curtis. Dr. Curtis was inspired to become a pediatric dentist after some poor dental experiences he had as a child. So I'm very sorry to hear that, Dr. Curtis. I know children are getting a much better visit from you these days. He strives to make dental visits fun for kids by providing gentle and compassionate care. Dr. Curtis graduated from Texas A&M University with a Bachelor of Science, and he did his dental work at the Baylor College of Dentistry, where he was awarded his Doctorate of Dental Surgery degree. Remaining at Baylor, he completed a rigorous pediatric dentistry residency and is an Academy of Pediatric Dentistry Harris Fellow. Dr. Harris is also American Board of Pediatric Dentistry certified, and he and his wife Rachel are proud parents to Birdie, Dodson, and Emerson out there in East Texas, if I remember correctly. In his spare time, he enjoys, of course, spending time with his family and everything Disney. So with that being said, I'd like to warmly introduce tonight's speaker, Dr. Ben Curtis. Dr. Curtis, take it away.
Thank you so much, David. I appreciate that great introduction there. And I'm really excited about this topic. We broke it down into 3-part series for you here. The first part is going to be about communicating to your pediatric patient. The second part is going to be about communicating that to the parent. And then the third part is about communicating it to your referrals. So kind of a triad of importance there when it relates to communication. And I'm really excited about the pediatric part of this. So let's kind of take it away from here. Move on here. All right, who am I? So as David kind of said, first and foremost, I'm a dad. Here are my kiddos here. Birdie, she's 6. Dotson, he is 4. They're both at soccer right now. And then little Emerson hanging out there in the middle. We live on a ranch out in East Texas, about an hour outside of Dallas. This is our pet cow, Muna. So the kiddos there, she thinks she's a Great Dane and not a dairy cow, huh? And when we're not on the farm out there, we like to go to Disney World. This was us this past fall. We masked up and braved the elements and the rain and all to go hang out in Orlando, and we had a great time there. As David said, I did my dental school at Baylor, did my residency at Dallas, here at Children's Hospital, part of Baylor College of Dentistry as well. Diplomat to the board certified pediatric dentist. A Harris Fellowship with sweet Dr. Susie Seal. If you had the privilege to meet her, it was a privilege for sure. She's a wonderful lady. May she rest in peace. I'm also on the Southwestern Society of Pediatric Dentistry board, and they do an awesome ski meeting each year. So this was us in Vail from this past year. And I'm in private practice here in Dallas, Texas with one of my crazy colleagues here, Dr. Rena Kuba. We work together here in Irving, and I also practice at an office in Dallas as well. I am an educator and trainer and the executive director for the Waterlase Pediatric Dental Academy. So I work very closely with Biolase, and they are so kind to provide me to you this evening through an honorarium. So a disclosure there for that. But I really enjoy my time being able to educate individuals on laser dentistry. And for tonight, we're going to focus on the communication portion of that. For an overview, we're going to start off talking about tell, show, do with a twist, though, with a laser twist. So we'll talk more about that. It's my favorite part of the discussion. Then we'll understand kind of what is the patient feeling and how does that play into their cooperation and helping them to cooperate. And then picking the right behavior management technique to help your child through the dental procedure. So sweet Maya Angelou, do the best you can until you can do better. Then when you know better, do better. So it challenges us to not just be the best we can, but to always be looking for the better version of the best we can be. And for me, that's what really laser dentistry is all about, how it fits into my practice every day. I can do things many, many ways, but what's the best way I can do it? And then is there a better way to do that? So that's my challenge for you tonight, is to think about how you're doing it. And is there a better way you could be doing that? So can we take something more out of tonight's discussion? First, we're going to talk about communication, okay? It's key for this 3-part series here, communication. Albert Einstein put it this way: the world is as we see it, only is the world as we see it. Others may see it differently. When we think about Einstein, his theory of relativity, everything is relative. It's as we see it, as our mind thinks it is. Communication is pretty much how you think someone is talking to you, from body language to their verbal skills to their tone of voice. And it's all how we see it, how we're choosing to see our world. How do we see it differently? We all see it differently, from an adult to an elderly patient to a young toddler to a teenager. They're all going to see the world differently. They all have different experiences, different backgrounds, and all are going to have different ways that they're going to communicate. You're not going to be able to talk to them all the same and get through to them on the same level if you're talking to each of them the same way you would talk to them. All the world is a stage, and so is your office. If there can be a big takeaway for you from this, I preach to my staff and I preach to the dental residents that I have come into my office that I get to talk to, that the world's a stage. You're performing in pediatrics from the moment you walk in the door of the office to the moment you leave. You're performing for the patients, you're performing for the parents, you're performing for the grandparents, you're performing for the staff. It's a stage, and your office is your main spotlight, and you have to rise to the occasion. And that really comes down to communication. Some of my assistants, they laugh and joke that I don't talk to the people the same way. Each patient I talk to differently because I'm trying to meet them where they are. I'm going to talk to each one of them in a different way to help make sure I can communicate best for them. And that leads us to the time to perform. So classic performance in pediatric dentistry revolves around tell, show, do. So what exactly does that mean? The classical definition for it, as it comes out of the AAPD reference manual, this is cited from just this year, involves verbal explanation of procedures in phrases appropriate for the developmental age of the patient. So that's the tell part. So we're going to tell them about what we're going to do before we actually do it. We're going to explain it to them. Once again, we're going to explain it differently to a 3-year-old than we would an 8-year-old, than we would an 18-year-old. We're going to talk to them all differently about it. You may talk to your 80-year-old like you might talk to your 8-year-old, or vice versa there. I don't get into the older patient realm there. Then the next part for the show, it's demonstrating for the patient the visual, auditory, olfactory, tactile aspect of the procedure in a carefully defined, non-threatening setting and non-threatening way. And what I mean by that is that we don't want to be using words that can be misinterpreted into a different way. So as saying like, oh, I've got a little tiny bee sting here. Nobody wants to be stung by a bee. That's terrifying. My daughter sometimes doesn't want to go outside because she's afraid of bees. So if you're trying to describe to her that something's going to be like a little bee buzzing around, she's going to freak out. So we have to make sure it's a non-threatening way to describe it. So we'll talk through that as it relates to the laser and how we can help make sure that we're getting great patient acceptance from that. Then, without deviating from the explanation or the demonstration, you complete the procedure. So you're going to do it in the exact same way you explained it to them. So that helps build the trust for them that you showed them this, you told them about it, and now we're going to do it exactly how we said we were. So that's classical tell, show, do. What's the goal here is to help the patient understand what's going on and what's going to happen to them. Some patients really need to know in detail what's going to go on and how it's going to happen. My wife likes to know the details about procedures and this and that. I'm not that patient. I just want you to do your job and do it well, and I'm just going to show up and get it done. I'm that type of patient. There's all different types of patients out there. And the tell, show, do is trying to help get that patient the level of understanding, the level of knowledge that they need that's appropriate to their age level as well, and their level of understanding. Sometimes you might be dealing with a patient that's 11, but is developmentally delayed at the age of 5. So you want to talk to them like a 5-year-old, not an 11-year-old. Or you may have an autistic child that's high on the spectrum that's more of like an 18-year-old at the age of 10. So you want to make sure you're talking to them appropriately for their age. You're going to give them something to think about versus allowing them to create their own thoughts. If we leave children up to their own thoughts and their own discretions, they're going to make up a bunch of things that you don't even want them to think about. So we want to keep them distracted through it, but at the same time, we want to give them things to think about. We want to give them imagery. We want to give them things to focus on. And that is classic tell, show, do. Is a combination of doing it while distracting them all together. Children have vivid imaginations, so you want to use that to your advantage here. Sometimes I hear people, particularly dental students, when I'm talking to them, that they feel stupid or they feel dumb or that's just ridiculous. I feel silly when I say things like that. Well, if you don't feel comfortable doing it, or that may just not be your style, or that's not something that you're good at coming up with. Maybe you lost your imagination a long time ago. You're not a Peter Pan in adult form here. That's okay. A lot of times you may have a rock star assistant that would love to do it. All of our assistants love to talk a child through an appointment. They pride themselves on their ability to help that child, not just me do it. They pride themselves on their abilities to do it. So if you're one of those doctors that may feel kind of silly as far as doing these sorts of things for tell, show, do, then you can rise to the occasion with your staff members and empower them to really help do that. And they can talk them through the whole appointment as you're doing it. You may want to laser focus and just kind of have silence as you're working through this. Well, you don't have to talk if your assistant can talk them through it and everything too. So a good assistant can really help out a lot in the tell, show, do distraction situation. So this isn't just for the doctor here today. It can be used by many of our staff members as well. When we're talking about traditionally using a Waterlase I+, we're talking about comfort prep, rapid prep, and bond prep when we're looking at doing a class 2 composite. So we'll kind of focus on walking through a class 2 composite with the tell, show, do, and helping that patient understand what's going on so we can get the best acceptance from them. Classically, we've been taught, and we think about comfort prep is where we're kind of getting the patient where we need them to be, where it's removing some tooth structure and you're trying to numb the tooth by defocusing and focusing, defocusing and focusing on the tooth to kind of get that tooth more ready to then remove it. And then for the rapid prep, you're removing a lot more of the tooth structure away. And then the bond prep is really just to remove the smear layer away. Okay, so we spend the majority of our time probably in the comfort and rapid prep with probably very little time down in the bond prep at all. Well, we're going to kind of change that thinking here, and we're going to kind of turn it upside down, and we're going to apply this to pediatrics in a different system here. All right, we're going to teach you the pediatric way, all right, or what I like to call the tell, show, do method for utilizing the laser for fillings and crowns for children. And I've refined this and tweaked this over the past 5 years or so, and it works really well. And so this may be my favorite part of this 3-part series. So lean in. This is some good stuff we're about to dive into. So what do we do first? First, we're going to start off in bond prep, okay? And I like to start off in the class 2 bond prep area here, okay? Well, I start the sound off for the child so they can hear the sound. I'm not going to put it directly in their mouth. We're just going to say, oh, we hear this noise here, okay? And then we're going to slowly let them feel the sensation of what that feels like on their tooth. We're going to deliver a low level of energy without removing any tooth structure. So realistically, you're not doing anything to the tooth as far as removing anything, but you're getting them used to what it sounds like. So we're starting them off on a low level so they can feel that without having to feel too much of the power of the laser just yet. So we utilize the bond prep not for bonding and not for tooth structure removal, but to deliver the patient an easy thing to understand and to feel and to work through first, okay? Well, how do we describe to the child this bond prep setting? Well, I describe it like a little butterfly. All right. As I'm touching it over the tooth, do you hear my butterfly flying around? Do you feel the butterfly tickling your tooth? Do you feel it? Yeah. Oh my goodness. Yeah. That's my little butterfly flying around in there. And I'm just hovering right over the tooth portion where I'm going to be removing the tooth a little bit later. And I just let them feel the sensation of the laser and I tell them what it sounds like so they can imagine that it's a butterfly kissing their tooth and flapping its wings through there. So let's listen to hear what it sounds like. So I'm bond prep. So it sounds like just a little buzzing noise. And this is key where you want to describe it appropriately. I hear people, like I said, saying, oh, there's a little bug flying around in here. My 2-year-old's terrified of bugs, okay? If he thinks something in the bathtub's a bug, he's screaming, bug, 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 get it out. And we have to go remove the fleck of dirt that was from him that he thinks is a bug from the bathtub. So understandably, we want to describe it in a least threatening manner. Remember from the definition, that's very important that the words, the imagery, the things you're using to describe here is very important. If we say to the patient that, oh, there's a wasp flying around, or there's a little mosquito that's buzzing around, mosquitoes bite you. You end up with a welt. It itches and it hurts. Not a good thing for it to be. But a butterfly is sweet. A butterfly flutters. Kids love butterflies. Little girls have butterflies on their clothes. It's very much a non-threatening insect. So a great way to go to describe this, okay? So once again, for bond prep, we're not doing any more than just really getting the patient used to the sound, the sensation of what the laser feels like, and helping them understand this doesn't hurt, that this is okay for it to spray this water, for it to make this noise, and that it's okay for it to feel this way. Then we're going to step it up in step 2 and move up to the comfort prep setting. And we'll start this off just probably how like you do before. We're going to defocus it pretty far away from the tooth and then work it closer to the tooth and away from the tooth in a slow manner. We're going to do this for about 30 seconds as well. We did bond prep for about 15 seconds to 30 seconds. Now we're going to kind of do the defocus thing again for 15 to 30 seconds. And then we're going to move it into 1 millimeter away from the tooth with a gold handpiece, and we're going to start removing the tooth structure now. And just like this image shows, we're going to remove out our isthmus and start trying to remove out the outline from where we're going to create our prep. Just like you would do with a 330 burr when you start to make the outline of your prep. We're going to do the same thing here on comfort prep, okay? Well, how do we describe this to the kid? Well, I describe it to them as popcorn. Most of my kids we use laughing gas for, and we've got a TV above so they can watch a movie that they pick off of Disney Plus. Of course, I make sure it's Disney Plus. And we're gonna watch a show and we're gonna sing along to the songs and we're gonna have a really good time. Well, my kids love to have popcorn when they watch a movie all the time. They want to snuggle up on the couch with a blanket and popcorn. So we turn on a movie, we wrap the kids up in a blanket in the chair so they're nice and warm and cozy. And it makes sense that we're going to have popcorn now. Okay. And so I once again do it the same way we started off with the bond prep. I show just the noise at the defocus distance. Oh, do you hear my popcorn? I love to eat popcorn when I watch a movie. Don't you? Can you hear my popcorn noise? And then my next favorite question is, can you smell it? Do you smell the popcorn? You'd be so surprised how many of these kids will tell you they smell popcorn. And I'm always looking up at the parent. We almost always have the parent in the room for our treatment. And I'm just making contact with them laughing that, it doesn't smell like popcorn. It smells like cherries or whatever flavor that nitrous nose smell like. It does not smell like popcorn, but the kid believes you. The kid trusts you. The kid has such a vivid imagination. They want it to be popcorn. They hear the noise that they are believing is popcorn. And so they're engaged. They're part of the process and they are wanting to have a good time. And so you're going to have way more patient acceptance if you can get the patient involved in the appointment, not just passively sitting there quietly, but if they're actively participating in the appointment, they're gonna love it. And the parent's gonna sit over there and think you're the most amazing thing ever, that you've got butterflies and popcorn flying around in here. And it's only been a minute into the appointment at this point, and the kid's having a great time. Well, let's listen and see what the comfort prep sounds like. So we've got a little bit of a louder noise, but still just a popping, okay? Still just popping there. So it's just a little bit of a louder version of what it sounds like when you've got the bond prep on. So how do we describe that? Once again, we want to make sure we're letting them know before you're turning the power up that it's going to sound differently. You've prepped the patient for a butterfly, but my gosh, that doesn't sound quite like a butterfly, okay? It sounds exactly, it sounds louder, so it's going to be a little bit more startling. But if you prep them for popcorn, when they hear it popping, they're going to be excited about it, okay? The other thing I'll mention here is that depending on the tip size that you're using, it's going to sound different. So if you have on an MZ8 tip, it's going to be louder than if you have on an MZ5 tip. Okay. And so just know that you may have to prep your patient or help them expect a little bit of a louder noise if you're going to be using a larger tip to do any prepping with. Okay. And also, we're talking about the gold handpiece here. If you're going to be using the turbo handpiece, it does sound a little louder too. Okay. So we just want to be conscious of helping them understand that noise difference if we're going to be changing around the tips or changing around the handpiece here. So then after I've done kind of my outline of the prep, I'm going to step it up to rapid prep, where I can move a little bit faster and removing some tissue here. I'm not going to spend as much time getting them used to this noise because they've already been used to the popcorn noise, and this is not going to sound very much louder. It's just going to be a little bit more rapid, thus the name rapid. The pulse is going to go a little bit quicker here. And so I'm not going to spend 30 seconds getting them used to rapid prep. I'm just going to go ahead and get it kind of started there in a 10-second use, describing it to them, then moving on with my tooth removal process. Well, how do I describe this to the kid? I like to call this my helicopter because it sounds a little bit louder, like I was saying, but not too much different. We could pass this off as popcorn, but I'm normally trying to describe it as something else to them just so that they're knowing something else is going on here. And they may be feeling something a little different because we're getting a little bit deeper down into the tooth structure. So I call this my search team, my helicopters coming around looking for those sugar bugs, for those cavity bugs in here. We got to get them out of here. Can you hear my helicopter? It's coming. Here comes the search party. It's going to help get those bad sugar bugs out of there. I'm so glad we got the good guys on our side today. Every kid loves a good cartoon, and it's always good versus evil. And so we're going to make the sugar bugs the bad guys, and we're going to be the good guys here. We've got our own personal search helicopter that's going and looking for them, and we're going to remove it out of there. We're going to make it sound like it's the best thing ever. And I really hype it up when I'm talking to them about it so that once again, they're active participants in the process. They're not just sitting back. You're getting them involved in the appointment. And when you can get that kid involved as a participant, he's believing that this is happening and he's helping with it, you've won the appointment. And so these kids will do a lot for you because they trust you. And building on this tell, show, do method is going to win their trust so much quicker here. And once again, I'm not numbing for these. I didn't waste time doing an injection and having to walk them through that. They haven't had any pokey, stabby feeling, things like that. we're just going straight to the laser and removing tooth structure away here. And at this point, we've probably only been doing this for maybe a minute and a half. So it's going really quickly. We're not spending a lot of time on each of these. We're moving really efficiently through this tell, show, do method and getting that tooth structure removed quickly. So let's listen to see what this sounds like here. So the same thing. Basically, rapid and comfort prep sound about the same. My audio doesn't pick it up as quite true as it does, but if you've got one in your office, you definitely can appreciate that there. And so just the popping noise again. So it's kind of just a little bit of that noise. So the helicopter is another great way to kind of describe that for your patients here. Well, the next part of my tell show do is I normally am always using a high-speed handpiece. I don't use the laser exclusively to completely prep my tooth. I could, but I really like the precise edges that a 330 burr provides for me for my preps, and I like the way it looks better on the x-ray. So I'm always going back at the end and refining out my prep so that we can make sure it's nice and clean through there. So how do I describe to my patients what the high-speed handpiece sounds like? I call it my water whistle, and we're going to the water park. What kid doesn't like to go to the water park? That's what I ask them. Do you like to go to the water park? Yeah. Have you ever been to the beach before? Awesome. I love to go to the water park. I love to go swimming in the summers. Let's take your teeth to the water park. Yeah, that's gonna be great. Here's my water whistle. It's gonna make this wee noise. They get so excited. Did you know your teeth get excited to go to the water park? Just like you and I get excited? Let's take these teeth to the water park. We're gonna listen to them go wee, wee, wee. And I turn on my high-speed handpiece and it goes wee. And then we tickle the tooth, we spray it, and I refine it. Takes about 30 seconds. And now I've got this perfect composite preparation done there. Nice and easy. Walking them through. Well, that's kind of hard tissue. That's how I like to do it for the hard tissue portion. Where I start them off on bond, I work them up to comfort, then I work them up to the rapid, then I work them up to the high-speed handpiece to finish it off in the end. Depending on the size of the cavity and the cooperation of the kid, that whole process can take me about 2 to 3 minutes or less to do the whole thing and get it ready to put a filling in there. Which for a kid, that is really fast. Okay. The big difference here is if you're having to do an injection, that's more chair time that the kid's gonna have to sit there while they're getting numb. And chair time in pediatrics isn't just money, it's cooperation. So the less time that kid has to sit in that chair, the better they're going to be, the better the experience for the patient, the better the experience for the parent too. The parent's less anxious trying to worry about how much longer the kid's going to be able to last in the chair. And if you didn't have to numb, that kid can walk up and leave out of there and go eat Chick-fil-A afterwards. The mom doesn't have to worry about the next hour or two with the kid being numb, biting their lip or cheek, or the kid being so upset about the numb feeling. A lot of times the parents get so anxious about the injection. How's my kid going to do with it during the procedure? And how am I going to do taking care of them after the procedure? If you can eliminate all that and get this done efficiently and help them have a great experience, this is the wow factor for me in my practice. So many parents can't believe it was done so quickly and that the kid enjoyed the process. It's mind blowing to them. And honestly, it's still mind blowing to me at sometimes that we can get it done so quickly and have such a good time. My assistants love it. Let's kind of talk about how we might talk a patient through a soft tissue procedure. We think about frenectomies for infants. Well, there's not really talking them through anything. They're just going to cry. They're pre-cooperative, pre-understanding. But at around the age of 3, we really need to be starting to try to talk them through the appointment on their level. So if we're going to be doing some soft tissue procedures, frenectomy, mucocele is really common in early childhood for them to get trauma to the lip and need to do that there. That can be things that we need to be able to walk them through, okay? So we'd be doing, like I said, frenectomies, gingivectomies. So if we're gonna be doing a teenager for gingivectomies, that can be really important there to help them understand what you're doing. Ulcers as well, that's a really common thing that we find coming in for limited exams. I describe it to them as the butterfly. Again, that soft tissue setting doesn't sound too much different than bond prep. And so I just describe them as a little butterfly that's going to be floating around and tickling their tooth, tickling those gums. If I'm going to describe it to a teenager, I'm going to tell them it's a special little flashlight that's going to help remove away just the right amount of those gum tissues. And it sounds just like a butterfly floating around in there. So just pretend for me that I got a butterfly that's tickling your gums. I kind of make a silly deal out of it. Like, I know you're too big for this, but I've never had a kid that didn't appreciate the fact that I was trying to be funny, yet helping them feel like I got you under control. It's okay to feel like a little child right now, even though you're a big child. Deep inside all of us is a little kid that's still there. And I talk, if I'm ever having to work on an adult patient from a staff to a family member or stuff like that, I still talk to them just like they're 16 again. Wouldn't we all like to go back and be 16 again for a day? So we're going to talk to them like that. Let's listen to see what it sounds like here. We got it on the rapid cut setting for the frenectomy. It's sitting at an NZ6 here. Just a little buzz. Awesome. Play that off as a butterfly there. Okay. There's no need for the helicopter here. We're not searching out any bad guys. We're removing some gums, but that doesn't play as pretty here. It's not as exciting. So is this completely pain-free? As we talked about, can we get this done without having to numb them? Is it painless or sensational? Sensationless. So two quite different terms there. So they're gonna feel something, okay? It's not completely sensationless. It can be painless if we can help them work through it, okay? So it's really important through this tell, show, do process that you're trying to help them understand you're gonna feel something, okay? And it's okay for your patient to feel something. It's impossible for them not to feel something. If you're going to inject them, they're going to feel you give the injection and they're going to feel the numbness after that injection. Okay. So it's not that they're not going to feel something. When we're working on adults, they can understand that that numb feeling is an okay feeling. For children, sometimes that numb feeling is not an okay feeling. And sometimes this laser feeling is a way better feeling for them. So we want them to understand that. And when you started off on that bond prep, you're going to notice that maybe their pupils dilate a little bit, like, oh, wow, okay, that's something. Their feet may start to move or they may shift around in the chair a little bit. And that's where I'm explaining to them, it's okay for that butterfly to tickle you like this. It's okay for that to be like that. Oh, do you feel that warm tingling from the butterfly flapping its wings? Then they settle in a little bit more. And the next thing, when I move it up to comfort prep and it makes that popcorn, you may notice a little bit of similar. That's not pain. That's them just adjusting to what that new feeling is that they're feeling. And that's okay. All right. We can stop and talk to them more about it if we need to. All right. But just know it's okay for them to feel something. I've had many patients that describe it to me as a warm, tingly feeling. Okay. And so that fuzzy feeling of a hug is another way I like to describe it. Oh, yeah. Can you feel that warm hug? Your tooth is getting a nice warm hug. Who doesn't like a warm hug? All right. And so just know that it's okay for them, like I said, to feel something, but we want to help them think about and put a thought in their mind of what they're feeling. We don't want them to come up with the thought on their own, or you know what they're going to call it, hurt. That hurts. Children, when stuff happens to them that they don't understand what it is and they don't know how to process that, if it's weird, if it's unusual, if it's strange, they define it as pain and hurt. So we want to help them imagine what this is so that they can have a better experience through it and they can cope through that themselves on their level. We must help them understand what they're feeling. That's one of the biggest things about tell, show, do. If you can't get another thing out of this, it's just trying to make sure that we understand the goal of tell, show, do is to help them better understand what's happening to them. So can we do the treatment without pain? Yes. Does laser analgesia work? Yes. Yeah, there's a great study out of JADA that came out in 2000 that specifically looked at an erbium laser. You want to make sure when we're talking about lasers that you've got the right wavelength, the right active medium there. So an erbium laser is what the BioLace I plus Waterlase laser is, and 98% of success with class 1s, 3s, and 5s had no discomfort there. Those class 5s can be quite sensitive. And then 94% of cases were done without anesthesia in another article. And then last, a third one, that the erbium laser had eliminated the need for local anesthesia and extensive caries in stainless steel crowns. I use this in the exact same way for a stainless steel crown. I start them off on bond prep, then I move them up to comfort prep, then I move it up to rapid prep. And I am able to walk them through an a tell, show, do method to be able to get the two structure removed and then finish off with a diamond burr at the end. Well, what if the child says it hurts? What do we do then? Well, you stop, okay? We're not going to hurt a child. But most of the time, the reason that that child says that it hurts is because they don't like anything. They're not going to like the eye slide. They're not going to like the rubber dam. They don't like the nitrous nose. They don't like the taste of this. They don't like the taste of that. They're not liking anything. They don't like the high speed. They don't like the slow speed. Your laser is not a magic wand. If they don't like anything, they're not going to love the laser magically. Okay. There are a few exceptions to that. I have had some special needs kids, some autistic children that the laser has worked wonders for them. They could not do traditional handpiece due to the vibration, but they can do the laser and they've done it very well. And so there are a few exceptions to that, but vast majority, it's because the child doesn't like anything, okay? Or maybe you went too fast. Maybe you didn't spend enough time winning that patient over in your tell, show, do, and you just quickly moved from bond to comfort to rapid, and the child doesn't like the way that that feels, and it is kind of a sensation that is not comfortable to them. And so we'd want to slow down and start over, okay? We also want to make sure you're not touching the tooth. Remember, this is meant to hover at 1 millimeter away and not sit right on top of the tooth. We're not touching the tooth. I'm always using the best topical ever around the gums of these teeth. So when I put in my wedge and my ring around the tooth, or if I'm doing a stainless steel crown, it could really help with the soft tissue anesthesia around it. And the same thing when I'm doing my phrenectomies and mucoseals, I really like the best topical ever, or some compounded topical. If you're not using a compounded topical, I'd strongly recommend looking into that. It can really make a difference in your patient's soft tissue comfort. And sometimes that can be the key to success or failure of the patient's cooperation for the appointment. When you're working at PEDS, it can be many things that lead to the demise of the appointment, and most of it's all related to cooperation. Well, do you fail if you have to give a shot? No, you don't fail if you have to give an injection. Just because you didn't want to give an injection, the patient didn't want an injection, the parent didn't want to get an injection for their kid. If you had to give an injection to get the job done comfortably, it's still a win if you got the job done well. We have to make sure that our patient's comfort is paramount. That's the whole reason we're doing this to start with, is to help them have the best experience they can have. Okay. So don't feel defeated if you're having to give injections. Let's talk about some other behavior management style techniques. We focus mainly on tell, show, do, but there's a plethora of options out there. And honestly, if you don't understand tell, show, do, I'm not sure I can help you with much more. Just kidding, it's okay. Sometimes these concepts seem foreign to us or seem strange or seem silly, but they can be so helpful. And so I spent the majority of the time for this lecture talking about patient communication as it revolves around tell, show, do, and how to help your patient with that. Because honestly, that is your number one defense, your number one way to help that patient become more trusting of you, to have a great time, and to really relax and let you do what you need to get done. So tell, show, do. Distraction. We've got TVs. TVs are distraction. We've got music in the background. Music is a distraction. If the kid doesn't like the TV, I'm turning on Michael Jackson and we're going to be jamming out to Thriller in the background and I'm going to be singing along. If it's a little toddler, I sing them songs all the time. All these little nursery rhyme songs, all of this. The kids listen to it on YouTube. The parents sing it to them when they go to bed at night. Grandma rocks them in the chair holding them. It's sweet, it's kind, it's familiar to them. So singing is a very common thing of childhood. Once again, if you don't feel comfortable with it, your staff may love this and find it to be one of the sweetest things. I can't tell you how many parents like to record me singing to their kid and like to post it online because they find it to be so endearing, even though I can't carry a tune in a bucket. I sound terrible. I'm not your America's Got Talent next superstar by any means. I might be on the bloopers, all right? But that doesn't mean that they don't appreciate what you're trying to do. And it doesn't mean that it doesn't work for the patient. Counting is another amazing distraction tool, particularly for our special needs kids. It can work amazing. I'm always counting. We're going to do this for 10 seconds. And after 10 seconds, we're going to take a break. 1, 2, 3, 4, 5. Isn't it calm? You listen to my tone of voice, my mannerisms. I'm not saying 1, 2, 3. No, we're being calm. We're talking through it. And then we get to 10 seconds and then they can have a break. Then we're going to do it for 10 seconds more. I do that a lot when I'm doing my laser tooth removal. Okay, we're going to take a deep breath through our nose and we're going to do this for 10 seconds. And I'm working for 10 seconds. And then we take a little break. We take a deep breath in, deep breath out, deep breath in, deep breath out. And then we're going to go again for 10 more seconds. Another one of my favorite distraction techniques is pets. Every kid wants a pet. If they don't have a pet, they've got a laundry list of pets. They all have them named. They know exactly what they want them to be. They want a gerbil, they want a boa constrictor, they want a Saint Bernard, and then they want a hairless cat or something like that. And then you want to know the names of all of them. Oh, do you have a dog at home? Oh, I have a dog at home. Does your dog do this? We talk to them throughout the whole thing, even with stuff in their mouth. I'm talking all about this, and they want to hear about my pet. They want to see the pictures. I want to see a picture of their pet. And so pets are such a great topic to talk about because kids love their pets. Adults love their pets. Who doesn't love a pet? Nitrous. I love nitrous oxide. It is one of the best tools in pediatric dentistry. I heard it once described at a pediatric sedation conference as God's gift to pediatric dentistry is nitrous oxide. Its ability to help a young child sit still and not fidget and not move. You can get a lot more working time out of a child. It does not take a bad child and make them good. It takes a helpful child and makes them so much more helpful. So if your child is a Frankel 4, he's the perfect little peach, the parent doesn't think they need nitrous, I still think it's very kind to give the child nitrous to help them through the appointment. It helps them relax, it's anxiolytic, and it is analgesic, so they don't feel things as much. So I thought this owl was a perfect little nitrous oxide owl. Oral sedation. Okay, I think this is a red panda, if I'm not wrong, but doesn't he look like he could be the cousin of a sloth here? This is how I want to spend my Saturday afternoons here with him on the tree. Oral sedation. Really, the goal here, like we said, is to take a helpful child and make them more helpful. It does not take the terrible kid and make them helpful. Really, the goal here is to increase their ability to cooperate and increase their ability to communicate with you, to have positive communication, be it limited yet helpful, okay? And that's really going to increase your chair time. So if you've got like 6 teeth that you need to get done, the laser can be an awesome adjunct to your oral sedation because you don't have to give local anesthesia. When we're doing our oral sedations, we're normally cutting our local anesthesia in half. You're like, well, geez, maybe I can only get this one side done if I don't have enough local to get over here. Well, with a sedation, you've got that on board to help give you more time to work. And so a lot of times I can couple an oral sedation with the laser and get a full 8-pack of stainless steel crowns done well within 30 minutes and get the child up and out the door, and then they can go eat right afterwards with 8 stainless steel crowns without their teeth being numbed. It's pretty impressive. The last resort when it comes to advanced behavior management techniques and things is IV sedation and general anesthesia. If that patient is severely anxious, has some weird medical condition, or is just pre-cooperative, maybe you just can't expect for them to cooperate. Don't be afraid for IV anesthesia and GA, even if that means we're not using the laser. Once again, this is all about making sure that we're helping the patient have the best experience they can have. And sometimes communication needs to be completely removed through anesthesia sources, okay? And if that's not a service you provide in your office, find somebody that can do that for you. It's a great referral to be able to get your patient over to someone who can take the best care of them and then them come back to you. That's a winning win every time, okay? It helps the office that can efficiently take care of them, it helps your patient, and it helps build patient rapport and trust for you that you got them over to the perfect person to take care of them. And so even though you may not be utilizing your laser for those services, it still can work out for you. We do IV anesthesia in my office here, and we utilize the laser to do frenectomies during our IVs. So if we're doing this, this, and this, and we've got a frenectomy that needs to be done, we just roll the I plus over and knock out that frenectomy for them as well. It works out really well too. Okay. Once again, we might have noticed at the bottom that we've got learn, do, serve. So it's kind of a theme for how I like to do my lectures. I like to never stop learning so that we can do good and better serve the patients in our communities that we live in. So I hope that today you were able to learn something so that you could take that to your office to do something to better serve the patients that find themselves in your great care. So thank you for tuning in today. It was a pleasure to get to talk to you about something that's near and dear to my heart, something that I've spent about 5 years ironing out the kinks with. And I hope tomorrow morning you can integrate this easily into your practice and help find that this is a successful way to help you take the best care of your pediatric patients. If you want to reach out to me, I'm more than happy to answer any questions you may have through email. You can email me. I'm very active on social media. On Facebook, I have my own doctor's page there, and on Instagram as well. You can find me at any of those places. So thank you so much for tuning in for tonight. Stay tuned. We're going to have live Q&A. Send those questions to me through the Q&A area, and then make sure you stay on to hear about how you can get your CE credits as well. Thank you.
Thank you so much, Dr. Curtis. I can vouch for all of those social media places that you are, because I stalk you on all of them. So I can validate with the audience that he is very easy to reach and always talking about how to improve not only his care of patients, but the overall care of patients. And it's something we admire about you very much, Dr. Curtis. So it looks like I'm going to my question panel here, might have just a small handful. I always let you know before we start, though, Dr. Curtis, sort of the breadth of the audience that you're speaking to, and the award for the furthest away participant goes to Dr. Normasari, who is joining us from Indonesia, where it is the morning there. So Dr. Normasari, good morning, and thanks for joining us. So the questions, I do have a few. You did address this. It might just be a repeat, but I think it bears repeating. Doctor, which laser system do you use? What is your choice? And how do you isolate the teeth for that treatment?
Great question. Great question. I utilize the Waterlase Waterlase I Plus laser. So it's an erbium chromium laser, and it sprays water, and it works at about a 1 millimeter working length for the both soft tissue and hard tissue with the gold handpiece there. So it is a great all tissue laser where you can do both soft tissue and the hard tissue components there. As you got to kind of see, it has a touch screen that makes it really easy because it's preset. So when I was showing you the noises and everything that it makes, it's got a really easy handpiece that looks just like your high speed, slow speed handpiece. It's really familiar for you, familiar for the patient, familiar for the parent. So that's really nice. It's not some crazy looking thing. It wheels right over next to you. So it's easy to store, easy to get around, easy to get into an IV sedation room when you've got extra equipment in there too. And so it's a really great all around laser and a piece of equipment to have in the office. When I am doing my soft tissue procedures, normally I'm using a bite block and some gauze for isolation. When I'm doing my composites and crowns, I love a good isolite or an isodry system so we can get the tongue blocked. They have a nice built-in bite block, and it's got that suction that really helps to suck out and keep things in place. You could easily use a rubber dam if you wanted to as well, but I really find myself liking the isolite and isodry systems for isolation.
Thanks so much, Dr. Curtis. This one should be fairly easy. It's from Dr. Matson, and they're curious as to where they get, quote unquote, the best topical ever. Their supplier doesn't carry it.
Yeah, no, the best topical ever is a small company. I believe they're based out of California. I think they've had issues with COVID because of the shutdown. California was really slow to reopen. So I'm not sure if they're actually back into production yet or back open. But it is a private company there. So I'm not sure that any of your major dental supply companies can get it for you. It would be something you order directly from them. But your local pharmacy can also have a compounded topical made for you that is an extra strength topical, similar to what the best topical ever would be. I first discovered the best topical ever at a trade show, at a dental show, and I was on the showroom floor, and one of my buddy's dads is an older endodontist, and he was familiar with the best topical ever, and we were not, and so he had us all try it. It was profound. It worked very, very well. And he got a really good laugh out of us swabbing that all over our mouths. So if you see him at a trade show when those reopen up, go over, give him a shout, give it a try yourself, but go easy on the topical. So if you order that and you use it on your patient, I suggest you try it on yourself first so that you can understand how profound that anesthesia is and how a little goes a very long way in a child. So you don't need a lot of it. Okay. Good question.
Thank you. This question is from Dr. Kusuhara. Forgive me if I did not pronounce your name correctly, doctor. And it's specific to the anesthesia effect that you mentioned. Their question is about the setting and technique, and the corollary question is this the same as going from bond prep to comfort prep and rapid prep? Hopefully I said that correctly.
Yeah, so when we're kind of going through looking at kind of the traditional way of kind of starting off on maybe comfort prep and defocusing, focusing in, defocusing, focusing in to work on numbing the tooth, or even different ways of doing it, maybe having a diode laser to go over the tooth, getting a little bit more depth of penetration on a numbing setting, and then coming back with your hard tissue laser there. That's two kind of ways to numb the tooth and kind of get it ready to work on. When we're talking about doing it in this tell, show, do method where you're starting off on the bond prep, really what you're doing here is getting the patient used to the sound and that sensation, that tingly sensation, as opposed to starting them off on a much higher level of energy there. And so you still can get that numbness that you're looking for, but it still can help kind of work around the different systems to be more efficient for you, okay? And sometimes with our adult teeth, they are much bigger, and you may find that you need to spend a little bit more time working through each of these steps to get it to the numbness that you need it to be. But on the baby teeth, they tend to get the laser numbness very quickly.
Thank you. And this might be a connected question. It's not quite the same, doctor. We'll stay here for just a moment. It's from Dr. Betro. And the question is, when you use the high-speed handpiece to refine your preparation, can the child then feel pain in that step?
Great question. No, they don't, because that laser has helped numb that tooth for you. You've gotten a slight depth of kind of depolarization of the nerve from the laser itself, and the tubules are not nearly as sensitive. So I'm working in Denton on the tooth with that high-speed handpiece, and the vast majority of patients do not feel anything at all. They're just hear the little whistle. They just work right through it like nothing's going on. I do the same thing with a diamond burr for my crown preps. That diamond burr is pretty aggressive, and it really kind of pulls at that tooth and pulls it away. And they do really well with it, really, really well. I think it's a combination of how the laser kind of denatures that outer layer of tissue that's left behind, where the high-speed handpiece can easily just pull that away like melted butter down to a much harder, solid tooth structure that has not been denatured quite as bit from the laser energy when that tissue remains behind. I hope that helps.
I think it did. Thank you. We have time for a couple more, but this might have come from the chat. Maybe going back to your special needs children comments and experience, are there any special tips, information that you might share using a Waterlase with special needs? And it sounds like it's been helpful for them in your experience. Can you just elaborate on that a little bit?
Yeah, great question. I find that a lot of times our special needs parents are always looking for the better way. If you want to think back to Maya Angelou, like there's the we do the best until we know better, then we do better. They're always looking for a better way to help their child through. And a lot of times they're very hopeful that they've read about this laser dentistry. They hear you can do it. Will this work for my child? This is going to be the answer. I found exactly what I'm looking for in you, Dr. Curtis. It's like, well, every child's needs are different. Every child is different. What's best for your child is not best for the child next door, and what's best for the child next door is not best for your child. Every child's needs are different, and we're going to rise to the occasion to do what's best for your child. That's what I tell them every time. And it really depends on that child, and you're not going to know until you get into the procedure. So I don't like to make blanket statements like, oh, this is wonderful to help all of the special needs patients. You can't say that. They're all so different. It has worked amazing on some of my autistic patients. I have a mom that has an autistic child who teaches an autistic swim class. I get a lot of autistic swimmers that come in to see me because she's such an advocate for the office. And that has really helped a lot of them. I also have other special needs patients that the rule kind of applies as it applies to, your other kids. If they don't like this, they're not going to like this, and they're not going to like this, and they're not going to like this. And the laser isn't a magic wand. It's just another tool that they're going to potentially not like. So you have to prepare the parent that this is a different way to do it, but they still might not like it.
Thank you, Dr. Curtis. We have maybe time for just a quick one here. It comes from an anonymous attendee, so I'll support them anonymously. They like your TSD method. How, sort of in that vein, do you explain an injection to a child who might be afraid of a needle?
Yeah. So my kids never see the needle. They don't even know it's coming. If they've seen the needle, you have not done your job. Okay. We are not the pediatricians waving it around in front of them. Not at all. We don't even say the word injection. We don't say the word shot. We don't say the word needle. As I'm talking to the parent, I'm talking about we are going to make that area, go to sleep, or I have them step out of the room if they want to actually talk about that. But I do not allow anyone around a child to talk about an injection, a shot, numbness, anything like that. That's first and foremost. Secondly, during the procedure, while I'm doing it, I've got the nitrous nose on blocking them. I've got them watching the show. So their eyes are thoroughly distracted upward. And then I'm coming from below into the mouth from down here. So this is blocked. If it's not, then I'm putting my hand here over their eyes and coming in with the needle and the syringe. And I'm telling them, ooh, what is your favorite kind of ice cream? My favorite kind is cookies and cream. What's your favorite kind? You like strawberries? Okay, I want you to take a deep breath through your nose. Okay, now I want you to take another deep breath, and I give the injection. I put it into the tissues and I have them take another deep breath. Does it smell like strawberries or does it smell like chocolate? Chocolate. I think I smell chocolate. Take another deep breath. Do you smell the chocolate? Ooh, it kind of feels cold, doesn't it? It feels very, very cold. Ooh, is it chocolate or strawberries? It's both. Awesome. And I look at the parent, I'm like, it was orange. It wasn't either one of those. So I like to describe it as a cold sensation to them because they're going to feel something when you give that bolus there into the tissue. And I like to describe it as cold for them.
Perfect. Well, thank you, Dr. Curtis. I think that's as much time as we have for the questions. We got through certainly 95% of them, but I will send those to you for